Hi, this is Michael Pham. I'm an MPH candidate for spring 2016, and this is my presentation on my capstone project about first responder EMS training in the province of Siem Reap in Cambodia. I'm also a registered paramedic and a training center faculty for the American Heart Association. So, for description of agency, this project I did in conjunction with the American Heart Association and the training site, the Seabright Training Center, located in Anaheim. And these are organizations involved in clinical training as well as lay rescue training in CPR, first aid, and emergency care. And so the research that the American Heart puts out, it's going into these educational programs that update lay rescuers and clinical personnel in the new guidelines when it comes to performing resuscitation or administering first aid or advanced cardiac life support. And this project is done in conjunction with USC Cat Global Health Institute and the Cambodian Apsara Heritage Foundation in Cambodia. So for the public health problem that's happening currently in Cambodia that my project is addressing is that Cambodia represents a fast booming country after the civil unrest and communist regime of Pol Pot. And after several decades, now the country is seeing economic growth, more traffic, more congestion, and higher demographic. As a result, there is also a higher incidence of pre-hospital trauma related to motor vehicle accidents and pre-hospital emergencies. And so currently, Cambodia has a poor state of underdevelopment when it comes to emergency medical care. There's limited access, and most emergencies are deferred to local hospitals. And so, given the nature of Cambodia's healthcare system, there isn't a established emergency medical service that's unified across all provinces. There isn't universal training, and individuals in ambulances are more so taxi drivers instead of actual first responders. And again, there's no universal access number in Cambodia like we have in the States with 911. So again, there's a big issue of undertraining and understaffing of personnel. So for the needs assessment that we made, basically there needs to be improved training and retraining of EMS personnel. There needs to be an increase in these skilled first responders that are trained in guidelines internationally, and the U.S. guidelines are the highest standard in terms of research evidence-based medicine and training. So there also needs to be a creation of a unified and organized EMS system, and also advocacy for government policy to regulate standard emergency responder training and establishment of a universal access number. However, for this project, focusing one step at a time, which will be for number one, improving the training and retraining of EMS personnel. So for the project objectives and implementation, again, for the objectives, we wish to establish groundwork in Cambodia with local stakeholders and agencies to provide first responder training. And I was able to go out there this term from January 15th to February 1st in Cambodia, where I stayed in Phnom Penh, the capital, and met with stakeholders, and also traveled to Siem Reap, the province, where the famous Angkor Wat temples are, and was able to establish contact with Apsara, which is the government-controlled regulatory body when it comes to the heritage sites, such as the famous temples. And so we're working with them in being able to have them accept our materials for training and possibly get an implementation going on before 2017. And my objectives are to provide translated materials from US guidelines and compacting it into basically a 24-hour course across 3 days that we can provide for the staff, and also providing a structured agenda, as well as proposed budget, equipment expenses, personnel ratios, and locations. And the goal is obviously to have this implemented, tested, replicated, and extrapolated to be used in other countries. So for some of the theoretical foundations in my project report, and as well as my project for capstone, is using the determinants of health framework and organizational partnerships, which establishes requirements based off of two entities that have a particular need, realizing that each organization has influence on the objective, and also each organization has a gain in mutual benefit from working together. And again, there is mutual benefit in having additional resources, increased credibility, and better understanding and responsiveness to community needs by working together. And this is exactly what we're trying to do between Apsara and the American Heart Association and the CPR Hero. So I also was reliant on the self-efficacy theory, which is a small subset borrowing from the health behavior model, where we mostly want to train the personnel, the guards, to be confident in their approach to difficult tasks, set goals for themselves to master this first responder training, apply the skills, be tested, and have competency in being able to deliver this emergency care in the rural provinces of Cambodia. So for our application results, again, we want to propose implementation to be done in this summer, 2016, gather funding and begin training for the personnel, establish testing, whether we do a pre and post test to show effectiveness of training so that we can perhaps publish this material, the findings, and have that data replicated. Again, get this data out there so that if we go to other countries like Africa, other third world developing countries in the Middle East, we set up this first responder training like we did in Cambodia, then well we can again have a established protocol that we can do in any country. We just have to translate the materials. And again, by following the curriculum, we want to set forth to split up didactic instruction, skills testing, and training the trainers, which is to empower the individuals by getting the guards to also become instructors as well, or the personnel. And again, that's in conclusion the project that I conducted, traveling to Cambodia for my capstone. And after establishing relevant stakeholders on the ground, now getting folks interested in accepting our materials. And I'm working on this project to get these materials out there and hopefully have an implementation going on before 2017. And really looking forward to having this project come to fruition, and very proud to do this on behalf of my practicum as well. Thank you very much.